My name's Sarah Thomas. I'm the evidence support, the primary care evidence support specialist. I'm working on a new 2-year secondment funded by Health Education England, and this forms part of a national pilot to support the primary care workforce training hubs. The purpose of this is to enable primary care staff to access and use evidence from published research and best practice to underpin decision making. A bit about my background then. I've worked in nursing in a number of specialties, and I worked as a staff nurse for 13 years. I've also worked at the University Medical Library. I've worked for the Mental Health Trust at Notts Healthcare, and I've worked in the library at the Acute Trust at Kingsmill for the last 6 years. So a bit about my role then. I can support you primarily by saving you time. I can support you with evidence-based practice. I can provide evidence and literature searches to improve your learning and evidence to improve your business or practice. I can provide you with guidance on accessing e-resources and using OpenAthens, and guidance or refreshers on database searching. I can also help you with current awareness and give you access to regular email updates on specific areas of interest. So I can help you save time by carrying out literature searches on your behalf. This might be to support patient care, but also it could be to support projects such as the GP fellowships, could be to support updates to clinical guidelines, clinical pathway design, or for research, if you wanted to carry out some research of your own and you wanted to find out what's already out there in terms of research, I could do a literature search for those reasons. Or equally, if you're writing for publication, I could do a literature search to find out what's already out there on the subject that you want to write about. I can also do a literature search to inform or update training sessions you might be planning. So some recent examples of evidence searches I've carried out are attitudes and barriers to wearing PPE for healthcare workers during the COVID-19 pandemic, or COVID vaccines and tinnitus. The PPE and healthcare workers search was on behalf of the infection control team at the hospital, and it was for research, education and professional development purposes. I found 2 broader systematic reviews on the subject, a number of journal articles and some advice from the RCN about PPE and COVID-19 in a work setting. The COVID vaccines and tinnitus search was on behalf of a medic to inform patient care. The journal search on this subject revealed very little literature on the subject, though there was research published on the exacerbation of tinnitus as a result of having COVID. There were, however, some stats on tinnitus as a side effect from COVID vaccines available from the Yellow Card Scheme reports, so this was of use and interest to the requester. Moving on to training, I can offer training on using OpenAthens or finding the evidence, searching the medical databases, health literacy awareness, critical appraisal, and knowledge mobilisation tools. The first of these, finding the evidence, looks at finding the best sources for the type of information you need. So this might include how to find guidelines or point of care tools, BMJ best practice or clinical knowledge summaries, or it includes how to access full text e-journals or accessing e-books. The medical database searching I can provide training on. It includes refreshers or learning on searching Medline, Embase or CINAHL or PsycInfo. You might want to come on this training because you've got an assignment for or some further study, or you've got to write a dissertation, or equally you may be carrying out some research of your own and want to find the current state of the research, or you could be working on a service improvement project or updating some training sessions of your own. Additional training I can offer includes health literacy awareness. During this session, we discussed how low health literacy affects a typical day's interactions. Critical appraisal. The critical appraisal session looks at critically appraising the research evidence. This constitutes workshops using the CASP checklist for randomized controlled trials. So CASP is the Critical Appraisal Skills Programme from the University of Oxford, where the checklists come from. These workshops do work best as live sessions. There is also an e-learning module in development on critical appraisal, which may be coming soon. Critical appraisal may be of interest to you, particularly if you're taking part in journals clubs or something like that, where you've got to praise the evidence. Another thing I can offer training in is knowledge mobilisation tools. These include tools such as knowledge cafes, randomised coffee trials, and communities of practice. If you'd like to join the library, this would give you access to resources via an OpenAthens password. It would give you access to current awareness via KnowledgeShare, which I will talk about in a minute, and membership of the physical library at King's Mill. There is a searchable catalogue for the library available online using this URL. So KnowledgeShare then, is our current awareness tool. So whenever we find high impact evidence in your area of interest or specialty, we'll let you know by email. Your personalised KnowledgeShare profile is created as broad or as specific as you need. If you'd like to sign up for this, I can email the forms out to you. So in summary, how I can support you is by providing literature or evidence searches, by providing training in using OpenAthens and accessing other e-resources, training in or learning or refreshers on the database searching of Medline, Synol, PsycInfo, Embase. I can offer health literacy awareness training, critical appraisal training, or knowledge mobilisation tools training. Can also offer you library membership and current awareness email updates on areas of interest. Thank you very much.
Thank you, Sarah, for this. You can offer quite a lot to our primary care team. I just had one quick question. How do we request your support in doing kind of evidence or literature searches?
Just email me at sarah.thomas22@nhs.net. If you'd like an evidence search doing, I would email you out an evidence search request form so you can send me the details, give me more details of what you want me to focus the search on, to make sure it's focused exactly on the right type of information that you had in mind, and to give an approximate deadline date as well. For training sessions, just email me at the same email address, and I can either tell you any dates of any upcoming training or arrange a one-to-one training session with you virtually.
Brilliant. Well, thank you very much. I'm excited about potentially attending some training and updating my knowledge, as it's been a while since I've had to do a literature search. So thank you very much again.
Thank you.